Okay, so the viral transformation of healthcare. When people ask me what I do, you have the airplane conversation, and I tell them I study social networks, they'll go, you mean Facebook? And it's true that I have an interest in Facebook, but the reason why I have an interest in Facebook is not because of online social networks, it's because of social networks like these. These are real-world social networks. These are the face-to-face relationships that we've always had, ever since we were huddled around campfires in the Serengeti. We've always had friends, we've always had family members, and we are a social species. And what we're increasingly learning is that it's that social nature of ours that can be tremendously powerful when we think about how to transform ourselves and transform our health. But in order to be able to measure these real-world social networks, you can't just pick a bunch of data out of the ether. You actually have to talk to people. And we have to ask people a set of questions that will help them to understand what it is that we're asking them. And so let me ask you, if you were going to map your social network, what would it look like? Well, let me give you a little bit of guidance. First of all, we have to answer this question: what is a friend? So think about the people in your life who you would call friends, who you would say that you're close to. As a researcher, we usually ask people to say one of two things, to answer one of two questions. One is, who do you discuss important matters with? Okay, so I want each of you to close your eyes and think. I want you to make your own list and list the people that you discuss important matters with. Okay, take a moment. Now, the other question that we ask people to answer whenever we're asking them to tell us who their friends are is, who do you spend your free time with? So again, think about, who do you spend your free time with? The people on these two questions may be different, right? We may talk to people about important matters that we don't spend our free time with, and vice versa. For some of us, this is going to be a close friend that we just happen to meet in the bus. For some of this, it's going to be a next-door neighbor. For some of this, it'll be a spouse. For some of these, it'll be a parent. But we all have these deep, close, meaningful social contacts in our lives. And it's these contacts that we think are really, really important. Now, to be able to understand the way we do the analysis of these social networks, I want you to think about your lists, the lists that you've made for yourself over the course of my brief talk here. And I want you to think about where you fit in the larger scheme of the grand social network. To do that, we need some way of visualizing what it is I'm talking about. And so we can start, for example, with the simplest network, which is just a pair of people. So you and one other person on your list. Okay, we're going to make you and that other person big green circles, and that line between you, that relationship, will be a line that connects those two circles. And that's all you need for a social network, just the people in the network and the relationships between them. But as you know, most of you probably named more than one person on your list. In fact, when we do this in Gallup surveys around the United States, the average person names about 5 people. And so we're not dealing with just one pair, we're dealing with many pairs. And in a group like this, it's very possible that some of you named people on your list who are also present in this room. Or you may be named people that other people in this room named, which means that you're connected at 2 degrees of separation from these other people around you. And so these pairs aren't just isolated, they're interconnected. And it's that interconnectivity that makes it really interesting really fast to study these whole social networks, because these are the things in which we live. We are really cells in this larger superorganism that is constantly breathing and living from day to day. Now, I first became familiar with the power of social networks when I was very young, when I was about 7 or 8 years old. I remember this commercial from the 1970s, and I don't know if you guys will be familiar with it, but let me play it for you just a moment and see if you can remember it. So this is a woman who becomes so on the people that we're directly connected to, there's this exponential growth in the people that we're indirectly connected to. So we have dozens of friends and hundreds of friends of friends of friends. Think about your lists. You know all those people that you named, but how many of their friends can you name? And how many of their friends can you name? it suddenly becomes dozens and hundreds of people very quickly. And so even if you only have one small impact directly on someone that you interact with every day, it could be that that impact ripples through the social network to have a really large effect on others. Now, I started studying this in the context of health when I met Nicholas Christakis at Harvard Medical School. He had been studying this effect between spouses called the widower effect, where when one member of a spousal couple dies, it dramatically decreases the lifespan of the other member. And his research shows from tens of millions of records in the United States that when the man dies, the woman loses about 2 years of her life. And when the woman dies, the man loses about 7 years of his life. I'll let you speculate on the reasons for the differences. But these are really strong, powerful effects between individuals. And he became very interested in, well, what if these effects actually spread beyond this relationship to other relationships? So it's the very same kind of question that I was asking whenever I was thinking about how things might spread in terms of political behavior or social behavior. And so we teamed up and we looked at this network. This is a network from the Framingham Heart Study. We discovered that they had been keeping social network information for decades, not for the purpose of research, but just so they could track people down whenever they wanted to find them every 2 to 4 years to bring them back into the study. And this is a study that's been going on since 1948. It's a beautiful, wonderful study. And they have all kinds of health information and social information. And the very first thing that we wanted to study was obesity, because we were very interested in this question: is the obesity epidemic literally like an epidemic? Not just in the sense that more people are obese today, but in the sense that our behaviors that lead to obesity can spread from person to person to person. And so here what we did is we drew, again, this network like I was describing before, just like the people on your list. And we drew each circle as a person, each line as a relationship, and we colored the circles to indicate who was obese, that was the yellow nodes, and who was normal weight, and that was the red nodes. And the immediate thing that we saw was that there was clustering of behavior. And the clustering was really extraordinary. Not only was it the case that if your friend was obese, it increased your likelihood of obesity, but it was also true if your friend's friend or even your friend's friend's friend was obese. I could do better than chance of predicting whether or not you would be obese. These clusters were really strong, and we worked out some statistical techniques to try to figure out how much of these clusters were due to choosing people who liked the same things, and how much these clusters were due to one person influencing another person's behavior. And when we finished that analysis, what we were able to show is that at least some of this clustering is probably due to the fact that our health behaviors have a tremendous effect on those around us, and they spread from person to person to person in the network. Now, we went on after the obesity study to actually study other things like smoking behavior. And smoking behavior was very interesting in that it was the exact opposite of the obesity epidemic, where we went from 40% or 10% incidence to 40% incidence with obesity. We went from 40% to 10% with smoking. And here what we did is we colored the smokers yellow and the non-smokers green. And you can see, there's a lot fewer yellow circles in 2001. But what you might not be able to see, because you're kind of sitting kind of far away, is that the smokers, something was happening to their social networks over this period. They were getting pushed to the outside. Non-smokers were severing ties with smokers, and smokers increasingly were only connected to other smokers. And we didn't see this at the beginning of the study. We only saw it starting in about the late 1980s when, at the same time, we saw the rise of public health campaigns. And so one of the interesting consequences of those campaigns is that while we made a lot of people healthier by helping them to quit smoking, the people who couldn't quit actually may have been made less healthy in the sense that we caused them to lose some of their friends and lose some of their connection to the network as a whole. And so this is one of the things that I think we have to consider for the obesity epidemic. If we're going to be using any kind of social pressure campaigns for exercise or for diet, we need to be very careful not to ostracize the people on that network and create these externalities that we would otherwise want to avoid. We also looked at drinking behavior, and drinking behavior was very interesting in that we had to look at two different kinds of behavior. There's sort of normal drinking, which is what the average person does, but there's also abstention and heavy drinking. And we found that both abstention and heavy drinking spread to 3 degrees of separation, just like obesity and smoking. But the interesting thing here is it didn't just spread through everyone. You won't be surprised to know that men are more susceptible to heavy drinking, but it was the women whose behavior was influential. And so one of the interesting things here is if you're designing an intervention, you kind of have a choice. You can either target the person who's susceptible, right? You can have a campaign directed at the men to try to help them to cut down on their alcohol intake. Or you can target the women who aren't susceptible, but who are going to act like multipliers as soon as you get them to change their behavior or their attitudes. And it's not clear, unless you do this social network mapping, which one of those two methods is actually going to get you more bang for your buck. And so this is one of the reasons why we think mapping these networks is so important, is because these are things that we weren't aware of until we started to put us all into these connected webs of humanity. Now, after looking at these health behaviors, we became really interested in the underlying basis of how it is that we transmit these behaviors. And so we became really interested in emotions. And so we looked at happiness. And here we did the same thing in the Premium Heart study. We drew one of these maps, and each person is a circle, and each line is a relationship. And we colored those circles yellow for people who reported being happy on this validated psychological index. And the people who were sad were colored blue. Get it? Blue? Okay, and here once again, we find the same thing as we find for the health behaviors, that these effects spread to 3 degrees of separation. So in other words, if I don't know anything about you, but I know your friend's friend's friend is happy, then I can do better than chance at predicting whether or not you're happy. Now, some people are a little skeptical about this, that this can spread in networks. We were talking to a reporter from the New York Times and trying to make him understand. It's like when you're walking down the street and you see someone else smile, you can't help but smile back. And he said, well, we don't do that in New York. But most people, they do have this tendency to mimic the emotions of others. And it's through that mimicry that we think that at least some of these behaviors are transmitted in these networks. We also have started to move beyond these observational studies, because it's very hard to know exactly what's going on in the observational studies. We think we've got a good handle on it for a number of reasons, but it's better to do experiments. And so we've actually taken some of these behavioral economics experiments that we've done in other research, and we've done them in the laboratory to see what happens when you expose different people to different kinds of behavior. So there's this one behavioral economics game where what I do is I give you some money, I put you in a group, and you can keep all the money that I give you, or you can give some or all of it away to the group. Every dollar that you give to the group is going to get multiplied, and it's going to make everybody in the group better off except for you. You're going to be stuck with the cost of making everybody else better off. Now, if you're selfish, you'll keep everything for yourself, and you'll hope that everybody else gives as much as possible to the group. But what we tend to find is that there's variation, that people have different ways of playing this game. And when we put you in one of these games and you observe other people being selfish, then you probably are influenced by that when you play the game again with a different group of people. And that's exactly what we did in the laboratory. We had people play with groups of 4 where they played with a different person every single time so we could create these networks. And what we found was that the giving behavior of the person in the first round influenced the people that they played with, and then those people changed their behavior and influenced the people they played with, and then those people changed their behavior and influenced the people that they played with, creating these generosity cascades. So just to be clear, if Eleni gave $1 more in the game she played with Lucas, then we found that on average, Lucas would give about 20 cents more in the game that she played with Erica. Erica would give about 8 cents more in the game she played with Jay, and Jay would give about 5 cents more in the game that he played with Brecken. 3 degrees of separation. Once again, we find this magic number 3. And so one of the things that we really think is that these networks are powerful because the way this network was structured, we were able to add up all the extra giving that came from that $1 change in the first round. And it totaled to 3. $1 got $3 in giving by other people. In other words, the network acts like a matching grant. And that gives you a real sense of just how powerful these social networks can be when we're thinking about health outcomes and trying to multiply the impact of our innovations and our programs to change people's behavior in the network. So I started this talk by saying that I'm not a person who studies Facebook, but these results, they obviously have tremendous implications for this new networked life that we have online. And so one question that I want to ask now is, how do we take our natural social networks online? How do you interact with the people on your lists? The odds are very good that some of them are on Facebook. More than half of all adults are on Facebook today. More than half. It's 100 million Americans. Not only that, but many of them are older. People sort of think it's a young phenomenon. It certainly skews young, but there are 5 million Americans who are over 65 who are active Facebook users, looking at pictures of grandchildren and so on. And so these networks, they have this tremendous power to be used possibly to be able to help us with health interventions. And so to answer this question, how do we take our natural social networks online, I'm going to turn to an expert in social media. Does anybody know who this is? Alyssa Milano, that's right. So you might know her from the hit series Who's the Boss in the 1980s, or the hit series Charmed in the 1990s. She's a television actress. And the reason why I'm talking about her is because she loves to tweet, and tweeters love her. In fact, when I took the screenshot, she had over 1 million followers, and I think that number just keeps going up. Well, the reason why I'm talking about her is because we found out through a friend one day that she actually did this. She tweeted a link to our book about social networks. And so you would think with everything I told you about the power of social networks, 1 million followers, aha, ka-ching, I'm going to be able to quit my day job. But let's see. One of the things that we are able to do is we're actually able to track and see what happens to book sales whenever something like this happens. And so we have this nice graph, I don't know if you can see it from the back, of how our book sales went up and down over the period, and see if you can guess where she tweeted. She tweeted right here, right before a precipitous decline. And so this is not science, this is just an anecdote, but it's consistent with what we've found. Online social connections are not in and of themselves good for influence. Okay, so that 500th Facebook friend that you have, they're not going to pay that much attention to you. Who do you pay attention to? You pay attention to the people on your lists, these deep, close social contacts. Now, some of them are on Facebook, right? But not all of those people are going to have an equal influence on you. It's going to vary depending on how close you feel to people. And just to give you like a clear picture of how different online networks are from real networks, here's a network of friendships in a college dorm, and we can layer on other kinds of real-world relationships, like we can look at co-membership in clubs, and that adds a few connections, or we can look at roommates, and that adds a few connections. But then when you layer on the Facebook friends, it becomes a big ball of spaghetti. The average person on Facebook today has 150 friends. You have to use air quotes these days around this word, right? These are not all people on your lists. And so the question is, how do we get at that data online? Well, we've been doing some very simple things. One of the things that we've been doing is taking some Facebook data, and rather than looking at all the connections where we don't see any correlations in behavior or outcomes, we only look at people who have tagged each other in photos. And so it's just like if you've never tagged a person in a photo, this is just like someone giving you a photo and you turn it over and you write Aunt Tilly and Sue, so that you can remember who these people are when you're trying to look at the picture 20 years from now. So the idea is that if you've done this, you probably were in the same place at the same time as this person in the past. And you probably, on average, are closer to that kind of a person than you are to all these other people that you're just sort of weakly connected to. And the average number of people that we are in photos with who we've tagged is about 10. And that's a much smaller number than 150. When we do that, we actually get networks that don't look like this. Instead, they look like this. They look a lot more like those networks I was showing you in the Framingham Heart Study. And here what I've done is I've colored all of the nodes in this network yellow if you're smiling in your profile picture, and blue if you're frowning. And we found that these clusters of outcomes, they extend to 2 degrees of separation. And in fact, just to be clear, if I don't know anything about you, but I know your photo friend is smiling in the profile picture, then I can do better than chance in predicting whether or not you're smiling in your profile picture. That doesn't have much to do with health. It's just sort of a nice toy example. But we also categorize the photos according to their BMI. And here what we were able to do is we were able to map the network of obesity in this particular subnetwork. And what we found is there were clusters of overweight women and clusters of overweight men that extended to 2 degrees of separation. And so the real world network lives on Facebook, but you just have to figure out how to extract it. And once you know what's there, then you can start to think of clever ways that you can create cascades of health. So we've now been moving into this question of how do we intervene in social networks? And there's 2 basic ways that you can do this. One is you can either change the connections, change who's friends with who, or you can change the flows, change what flows through the network, or change who you act on to make things flow through the network. So you can change connection or you can change contagion. Now let me ask you, raise your hand really high if you're willing to stop being friends with anybody on your list. Okay, so we've got a couple of cynics in the back. This is a really hard thing to do. It's very hard, except at certain key moments, like whenever you're assigning college students to roommates, or whenever you're assigning people in basic training to barracks. It's those key moments in our lives where you're setting up an opportunity to have these deep, close social bonds that allow us to be able to have some influence over the structure. Now, we may have more ability to do this at work, right, where we were creating work groups and things of that nature. But in general, connection's very hard. Contagion, we think, actually is going to be easier. And this is all about figuring out who to target and also trying to figure out how to structure an intervention so it has maximum impact. So we've done this in a couple of ways. First of all, looking at the structure of networks, we've mapped physician networks. And what we've done is we've looked at two doctors as being tied if they share patients with one another. They may not know each other, but they share charts. And so this is a way of spreading information through the network. And these are all different dots colored according to what hospitals they're in the greater Boston area. And you can see most people share patients with other members of their hospitals, but there are some hospitals at the center of this network that really share patients across a wide variety of the different hospitals. Well, one of the interesting things that comes out of these networks is when you look within a single hospital, you can actually now color the nodes according to whether or not people are specialists or generalists. And in this map, what we've got is specialists at the center of the network, and we can compare that to another hospital, also in New York, also about the same number of doctors, the same number of patients, the same number of dollars of patient care. And here on the right, what we have is a hospital where generalists are at the center of the network. Now, guess which one of these two hospitals has lower costs? The one where the specialists run the show, or the one where the generalists run the show? It's actually the one where the generalists run the show. On the left, the specialists, it costs them about $104,000 per patient in the last 2 years of care, and they have about 48 days of inpatient care during those last 2 years, compared to $46,000 in 25 days for the hospital where the generalists are at the center of the network. And this is just information sharing. And so one of the things that we were really interested in is thinking about whether or not we can act on these networks within hospitals to bring generalists more into the center of the network through some kind of social activity or the way you organize work teams, and thereby possibly affecting the way the hospital sees itself and the policy that it makes and the price of care. Now, another thing we want to look at is the quality of care, because there's obviously going to be some trade-offs, but this gives you an idea of just truly how extraordinary the relationship between networks and costs can really be. We've also started to look at situations where we don't have information about the network. So ideally, you'd want to know this about all your doctors, about all your patients. But typically, what we know is this. We just have a bunch of dots in a network. And so we've been trying to develop methods for being able to deal with this problem of not having network data. And one thing that you can do if you want to target people at the center of this network is that you can ask them, each of them, just to name a friend. So just give me the name of one person on your list, and I'm going to put them in my study. And the reason why this is important is because your friends tend to have more friends than you do. I know it's a very sad thing, but it's true. The probability that you name someone as a friend is related to how many friends they themselves have. So a person who has 10 friends is 10 times more likely to be named than a person who only has one friend. And so with just this easy trick, you can identify a group of people that you can intervene on or monitor a network. And we actually tested a monitoring system where what we were looking at is to see whether or not the people at the center of the network tended to get the flu first. We did this at Harvard College. Here's actually a movie of that network at Harvard College, and the red dots are people who got H1N1 flu-like symptoms, and the yellow people are susceptible. And it may be a little hard to see in the movie, but what tends to happen is the people at the center of this network, they get the flu earlier than everybody else. And that's in fact exactly what we found when we crunched the numbers. That yellow curve is the friends, that red curve is the randomly chosen people. The friends got the flu 2 weeks in advance. So any kind of monitoring technology that you have, if you monitor the friends, you get 2 weeks of warning. Anything that spreads in networks is going to be useful for using this kind of a method. And if you can predict something, you have a better chance of being able to change it. Now, there are lots of different ways that you can use this, not just with the flu, this would be like pathogens. So you can also use this with health information. So Damon Centolla has published a couple of studies recently showing that you can really influence how health information spreads online, for example, by structuring the network in different ways. Norms can be really important. So whether or not you think that BMI of 25 is overweight, that's something that potentially has been changing over the last 10 years, and that can spread in networks. And the behaviors themselves, whether or not you exercise, whether or not you you eat appropriately, those things can change. And those are all things that we should be looking at in these networks. Let me wrap up with a couple of other projects that we've been doing in conjunction with Healthways and Activate Networks. One of these is a bike walk program in the Vitality cities. And again, we don't have the network. We haven't asked people to make their lists. But one of the things that we've been able to see is that you can use publicly available information to infer a lot of these connections. And what we're trying to do is we're trying to see if we can draw these inferred networks and then see whether or not the people who participate in this bike walk program in one of these Vitality cities spreads from person to person in the same way that we've seen these other things spreading from person to person. We're also using email data in employers to try to infer networks, because there's certain kinds of email communication that people who have a close relationship will tend to engage in. It's not just quantity of email, it's also quality of email and what time you tend to email other people in the organization that can help you to draw these kinds of networks. And with these networks, you can actually start to identify natural communities. Like you might think of your business as HR and marketing and different kinds of functional parts of the organization. But these friendships, they often cut across those. And it can be very useful to know that, because if you're going to target a health intervention, you want to target it to the natural communities, not to some kind of institutional communities that you have in mind as being particularly important. And we've been able to show that these networks actually tell us what we think they do, in the sense that when we ask people to give us information or access to their health records, then we see that BMI clusters in these networks as well. And so this is a network at Healthways, within Healthways itself. Healthways is running the study on its own employees. And we see that, just like in the Framingham Heart study, that you have these BMI clusters in the network. And knowing that they exist and knowing where they are can dramatically help with targeting. And the next step is that we're going to start to see whether or not some of these well-known tested interventions, if we target them to groups of individuals who tend to be connected to one another, if we can really ramp up this multiplier effect in terms of getting the overall health of the population improved and the weight down. So let me just end on a personal note. It's been extraordinarily fascinating to me to see just truly how powerful these networks are for health outcomes. And I'm sure that many of you here you're thinking about your organizations and your plans and trying to think, well, how can we do interventions to lower costs and to improve quality? But this isn't just about what we can do to employers. This isn't just about what we can do to health. This is about how we live our lives. There's a small boy in this movie, Pay It Forward. It came out in 2000, and you can see he's a budding network scholar, because he had this idea that all you have to do to make the world a better place is to do 3 random acts of kindness to 3 different individuals and ask nothing in return except that they pay it forward, that they do the same thing that you've just done. And he drew this on the board to show that if you did this, then 3 would become 9, would become 27. That quickly you would have all of these random acts of kindness happening in the world, and the world would be a better place. And so when people hear us say that you're affected by your friend's friend's friend, I think they sometimes take away from that, I have no power over my own life. But in fact, what that means is not just that you're influenced by them, you potentially influence them yourself. That you're not just having an impact on the people that you can see, the people on your list, but also the people on their list and the people on their list. And when we realize our network power, I think it can't help but change us. I actually made a positive change in my own life after doing the obesity study. I lost 5 pounds and I kept it off, because I realized that whenever I made myself healthier, I wasn't just making me healthier, I was potentially making my son healthier, or my son's best friend, or even my son's best friend's mother. After 3 degrees of separation, there are dozens, and in some cases hundreds of people who are affected by our actions. And when you tell someone that they don't influence anybody, I don't think they take as much effort in trying to make the world a better place as when you tell them that they influence dozens, that many people indirectly look to them for their behavior. You are important. You have to think about the people on your list as your gateway to this larger power, your network power, because in the end, we're all connected. And that's what really makes us human. Thank you very much. We have time for a couple of questions, if anybody would like to come up to the microphones. By the way, this is my network. Sure, you just shout it out, I'll repeat it. So the question is, this person deals with an older population that doesn't have a lot of friends, and how do you get them involved? That's a good question. Changing networks is really hard. But fortunately, there are organizations around that have been doing this a long time. When we told Alcoholics Anonymous about the alcohol study, and when we told Weight Watchers about the obesity study, they said, well, duh. They've known about this for a long time, and yet we didn't have the very first randomized control trial of Weight Watchers just happened this year. Right? For decades, we've been doing this, and so one of the things that's really important is just to promote contact between the people that seem to be disconnected and people who are well connected in the network. One of the things that we found in a loneliness study was that there's this unfortunate tendency that when you feel lonely, you tend to break ties, and whenever you lose ties, you tend to feel lonely. It's this vicious cycle. And so really, to be able to protect the frayed edges of the network, you really have to work on reintegrating them. Now, my guess is that you probably know more about how that process works on the ground. What I can tell you is that what our research suggests is that there will be substantial multiplier effects if you're able to even connect them to a single other person. Okay, thank you very much.